Juuls are for fools. At least that's what the feds want you to think. The FDA announcing today they're officially banning Juul devices and pods. Not all vapes, just Juuls, willy-nilly. The company says they are planning to appeal. Their chief regulatory officer said in a statement, quote, "We respectfully disagree with the FDA's findings and decision and continue to believe we have provided sufficient information and data based on high-quality research to address all issues raised by the agency," end quote. Now, don't get me wrong. Smoking's not good for you, but people are still going to get their hands on vapes, and they could end up with very dangerous knockoffs. Does the ban achieve anything? Joining me now to discuss, Cato Institute senior fellow. He is a practicing general surgeon. Dr. Jeffrey Singer is here. Welcome to the show, Dr. Singer. Great to see you.
Hi, Kennedy.
I think this is a horrible idea. I think it is not only dangerous for kids, who will be the first ones to find the very dangerous knockoffs, it's bad for adults who are going to be forced to smoke low nicotine cigarettes, which means they'll just smoke more of them and get cancer faster. What are you seeing with this ruling?
Yeah, I think, first of all, it's interesting that they banned one of the most popular brands, vaping brands. At the same time, they cleared the way for its two biggest competitors, both of which are owned by tobacco companies. Now, you know, the cynic in me might make me suspect cronyism, but the doctor in me is upset because it looks like the FDA has lost all interest in tobacco-related harm reduction. The vaping products have been shown in study after study to be really effective means of getting people who want to quit tobacco smoke off of tobacco smoke. It's been more effective than nicotine patches, nicotine gum. And in fact, in the UK, Public Health England asks its primary care doctors to tell their patients who smoke cigarettes to consider moving over to vaping and hands them out brochures. So here we have the FDA, in its, I can't call it its wisdom, deciding that they want to make it, remove one of the most popular and established brands from the market, making it even harder for people who want to vape to get the products that they like to use. And as far as reducing the nicotine content of cigarettes, which is another one of their plans, you know, nicotine by itself, that's the substance that does the addicting, but it's the other components of the smoke that does the harm, that causes cancer, high blood pressure, et cetera, and heart disease. But nicotine is relatively harmless. It's sort of like caffeine. It's a stimulant, but it also has a calming effect. And many people smoke for the nicotine effect.
Oh,
so
yes.
If you reduce the nicotine content, in fact, the government-funded studies that the FDA wanted and based their decision on showed that when they reduce the nicotine content, people take longer drags of the cigarette and take more cigarettes because they're smoking to get the desired result.
Because they want the nicotine, obviously. I have a feeling it was some nosy Nancy calling the president a big donor, like, "My child is vaping, Mr. President. You have to ban it." And he's like, "Okay, I'll tell the FDA. They're dumb. They're not doing anything except for screwing up what's left of the pandemic response." And vaping has helped a lot of people get off cigarettes. We have 450,000 cigarette deaths every year in this country alone. That in and of itself is a pandemic, but prohibition doesn't work. At least vaping is an alternative to get people away from the thing that's giving them heart disease and cancer.
Exactly. And actually, in certain regions of the country where municipalities or states have clamped down on the availability of different vaping products, studies are now showing, in fact, the Yale University study showing that tobacco consumption is going back up because the people who were enjoying vaping, they can't get the vaping products they want. So I don't understand. There's no logic here. If the FDA says it's concerned about public health, this is the opposite of public health.
Yes, and tobacco use rates have been declining for years. We have a lot of problems right now, and it seems like a very odd place for the federal government to be focusing their attention. Are there any benefits to nicotine? Asking for a friend.
Actually, there's research being done that nicotine actually may be useful for the treatment of Parkinson's disease. There's other research that might be helpful in certain psychiatric diseases. Mm-hmm. It's like any other stimulant, if you take too much of it, you can get to toxic levels, just like you can get to toxic levels of caffeine.
And Red Bull.
But like Public Health England says, it's a relatively harmless product. But the sensations that it gives the user is what makes the user get addicted, have a tendency to get addicted to it.
Yeah.
So
they're going to get addicted to anything. So what would you rather have them be addicted to? Being sedentary fat smokers or very excited, soothed nicotine addicts? I know I would choose the latter. We've run out of time. Dr. Singer in the Woods, you are fantastic. Thank you for everything you do.
Thank you very much.
He's a great champion.